It's all about trying to normalise an abnormal grief and in turn then eventually integrate that grief to allow people not just to survive and go on living, but to be able to move forward with their grief.
Welcome to the HSE Talking Health and Wellbeing podcast. My name is Eamon Keogh. On this episode, we'll be discussing suicide bereavement. For every Irish person who dies by suicide, many others attempt to end their lives, and many more suffer the despair that leads them to consider suicide. Historically, as a nation, we've struggled to talk openly about suicide and how it really impacts us. Joining me to talk about this are Fiona Tuomey, CEO and founder of HUGG, the national suicide bereavement organisation Fiona established following her own bereavement by suicide to ensure that no one bereaved by suicide would have to go without support. And Ollie Skehan, who is the HSE National Suicide Bereavement Support Coordinator. You're both very welcome.
Thank you.
Thank you.
Firstly, a gentle reminder that some listeners may find this type of content upsetting, especially if you have been bereaved by suicide yourself. We'd remind listeners that trusted information and support is always available. Find out more by visiting hse.ie/grief or hug.ie. Fiona, just coming to you first. In my introduction there, I was borrowing from the Connecting for Life, Ireland's national strategy to reduce suicide. The impact of suicide is devastating, particularly for those closest to the person. But can you explain a little bit more about what suicide bereavement means?
I think to put that in context, we maybe have to take a little step back and think about how many people it affects. For every suicide that happens in Ireland, each death affects up to 135 people.
Wow.
So cumulatively, we're talking about an average of 60,000 people each and every year in Ireland who are affected by suicide. So it's an enormous number of people who may need a level of support.
Yeah.
But to go to your question about the effects of suicide, I think a suicide bereavement has so many layers to it, and each layer brings with it a level of grief and emotion and practical challenges which have to be overcome by the people who've been affected. I liken it to when a grenade explodes, that those closest to the blast carry the most damage, but it extends out. It's not this gentle ripple in a pond that people speak about. It's shrapnel wounds that are carried by many people right out through the blast zone, that 135 people.
Yeah, my goodness. Yeah, when you think of it like that, it's a significant public health issue.
It's an enormous public health issue. Every person who dies by suicide dies alone, and each suicide is tragic. So that's the starting point. And before people can even come and address the emotions and the shock, the despair, there are other things that are faced by those bereaved that are not faced in many other deaths. For example, you have a police investigation, the Gardaí, looking into how the person died to see, is it a suspected suicide? You then may have a coronial inquest. Each death by suicide has to go through the coroner's court, which is another formal process that the bereaved must address.
Yeah.
You then have the why, which each and every person, regardless of how the person died or when the person died or who the person was, there are always residual questions. Why? Could I have done more? Why did this happen? And that's long before you get to the grief. And coupled with that, there's the complexity of suicide. The reasons why somebody died by suicide are myriad and many. It's a complex situation. For some people, it might have been a known mental illness or some sort of emotional state that they were in. For others, it could be a combination of a myriad of factors, some of which only are revealed after the person has died, and they don't go away with the death, whether it was a gambling problem, a mental health issue, a debt, an extramarital affair, bullying. The list is endless.
Yeah.
So all of these factors are landed on a person's lap before you can even get to the grief. So that's a huge maze of complexity for somebody to have to navigate.
Yeah. There's a lot of layers there, actually, and people need a lot of different supports there.
Well, I think first and foremost, people need timely information that is accurate.
Yeah.
Every single person needs accurate information to try and signpost their way through that. And it's very important to say that the majority of people get this through family and friends, neighbours, their community. Once it's accurate, that's the starting point. From there, people need to be signposted to the type of support that they may need at that time. And that will change over the course of time. So it's not one type of support, it's a menu. And that menu has to be available to each and every person, regardless of the relationship to the person who has died or when the person died. Because as we know, grief does not have a timeline.
Yeah. Just to move on to the afterward survey, actually, which is the National Suicide Research Foundation and HUGG research that was carried out in 2022, which you were both involved in. Just to talk about that for a minute, this was a really important piece of work, Ollie, wasn't it?
Oh, well, it was huge from a HSE perspective because there's a tendency sometimes to think that the professionals and those who know best are in the HSE. And suicide bereavement is no different. But this is the first time that the people of Ireland were asked what their experience of bereavement by suicide was. And all that information that was gathered is just absolute gold for the HSE now in terms of building strategies going forward and planning and working in collaboration with organisations such as HUGG. So we have such an array of information now, and only some of it has been released to date.
Yeah.
You could mine down really deeply into really minute detail in terms of that research. So it's been fantastic.
Actually, Fiona, one of the key pieces that struck me was that out of the 2,500 respondents, 1 in 2 experienced multiple losses.
Yeah, and people don't think about that, because it's not something they'll have ever experienced in their life.
Yeah.
There's a huge amount of information that's unknown. For example, the whole idea of when there's been a suicide, within a family, is there intergenerational trauma that may in fact lead to other suicides within family, within friends? That sadly, almost everybody in this country knows of someone who's died by suicide.
Yeah.
And when we go back to the statistic that we mentioned earlier, that cumulative number of a minimum of 60,000, you can see how big this issue is. So that starting point, that afterwards survey, was the very first time that people in Ireland had been asked, have you been affected by suicide? If so, what supports did you get? What supports would you have liked? How has it affected you? It's been an enormous amount, as Ollie said, of information that is constantly been data mined to go and look at how can we help people. If we don't know the extent of a problem, how could we possibly look at addressing it in an effective way?
Yeah.
So it's a key piece of research that will continue to have benefits.
Very good. And will inform services and actions going forward.
Absolutely.
Yeah.
I mean, it brought forward things that people did not have any idea about. For example, the number of people who have lost friends to suicide.
Yeah.
That often they don't feel acknowledged within statistics. And when we're talking about human beings, loved ones who've died, they feel marginalised in their grief, that they're not worthy of support. It was just a friend. It was only a colleague. It was just my teammate. But this is extremely important. And then professionals who've been impacted by suicide, they too need support. Frontline workers, mental health workers, doctors, nurses, paramedics, the list goes on. So there are many types of people who have many different lenses, but all under the same umbrella of a need for good, accurate, timely, ongoing support.
Okay.
Yeah, so you can imagine somebody in professional on a frontline service, like a nurse or a GP, who could be bereaved by suicide themselves, trying to offer someone who's been bereaved by suicide. That's a very difficult situation for any to be in, carrying such a heavy load.
Yeah.
And then trying to support somebody who is lost in the midst of their grief.
Yeah. So in terms of supports that are available for healthcare professionals in that situation, could you tell us a little bit about those?
Yeah, there's a number of supports that are available to healthcare professionals. So the Bereavement Support Line, which is operated by the Irish Hospice Foundation, is a national free phone service. And it supports those who are grieving or supporting someone who's bereaved by suicide. It's in partnership with the HSE, and it aims to provide a confidential space for people to speak about their experience or to ask questions relating to the death of someone they cared about. In terms of HSE staff, the EAP, the Employee Assistance Programme, is a work-based support service for staff in the organisation. It's a confidential, independent service and supports employees with psychosocial issues. These issues may be personal or work-related. They can affect your job performance or home life. The service is free and available to all HSE employees. And for those who are not HSE employees who are listening to this podcast, there would be corresponding programs available in their workplace.
Okay. And just going back to that afterwards survey for a minute, I mean, another stat that stood out to me, that 74% of respondents were female. I know I work a lot with men's health, but men are typically harder to engage with. I presume it's the same on this topic when you look at the number of respondents or the profile of respondents.
Yes, sadly, men are less likely to reach out for support or to engage with services. We know this. To put it in context, more than 70% of all suicides are male. There will be probably a greater number of females who would be reaching out for support, just if we're dealing purely in numbers. Having said that, I think because of traditional roles and expectations around emotional support and mental health, men in general are a lot more reticent at coming forward, which is why I go back to that point of how important it is to keep trying to engage everyone, and in particular men, to engage with support in whatever that is for them. And that's something that HUGG are very, very keen to do, is to continue to extend the level and the types of supports we offer according to people's needs, because they are very different.
Yeah.
You know, men may not be as comfortable sitting in a room talking about their bereavement with a healthcare professional.
Yeah.
All of the services that HUGG offers are non-clinical. They are therapeutic, but they're non-clinical. So we offer support groups throughout the country. We do have men who attend them, and the difference is all of our services are delivered by people who have been trained by us, and they all have a lived experience of suicide. And that's very unique. We're the only organisation in the country doing that.
Yeah.
So it means that the lens that we're working from is a place of lived knowledge, which is brought into all of our work, both through our staff and through our volunteers. So that's a great comfort to people who come to us.
Yeah.
So to go back to your question about men, for men, some do come to our support groups. It's probably about 35% male, but we offer a myriad of other offerings. For example, grief walks,
Right.
where it's kind of like that side-by-side support where people might feel more comfortable. Conversations will naturally come up and they're in the company of the people who understand. So that's very important. And we've also done a series of things like, we call them coffee, cakes and conversations,
Yeah.
where people can come to a space where we will be talking about grief and emotion and bereavement, but in a setting that's very non-judgmental, where there's no expectation to talk or even to share your bereavement, but you know you're in a place of understanding and their supports are there if you wish to engage in them. And they've been very successful. So that's just two examples of some of the initiatives that we carry out.
That practical support is just as important really as the health-related supports.
Oh, absolutely. I think it's important to say that not everyone who has been impacted by suicide needs clinical support.
Yeah.
It's not an either or.
Yeah.
Some people may come to practical supports or peer supports or engage in creative arts, or there's lots of things that people can do. It's all about trying to normalize an abnormal grief and in turn then eventually integrate that grief to allow people not just to survive and go on living, but to be able to move forward with their grief. And that's a big ask, and that takes a long time. So it goes back to that menu. It may be somebody wants clinical support as well as some other therapeutic support, or in fact, information might be just enough. There are lots of different types of grievers. We think of men as being more of instrumental grievers. They like to do. You hear of men going out to build something or to make something better or to fundraise. That's all instrumental grieving. But it doesn't mean they're not emotional. Of course they are. It's just a different way of expressing emotion. So I think we have to recognise the different types of grief and be more informed about what grief is and what it looks like.
Okay.
With regard to men, and as Fiona says, they're a difficult nut to crack. You have to think outside the box a bit more with men. You have to kind of meet them where they are. I remember meeting John Evoy a number of years ago, who was the founder of Men's Sheds in Ireland.
Yeah.
And he was talking about the first couple of engagements he would have had with men. And he said if he had advertised that there was going to be a town hall meeting this evening and we were going to address all the issues that men of a particular age, probably more elderly men, have in their lives, like financial issues, relationship issues, so on and so forth. If he'd kind of advertised that these were the issues that were going to be addressed, nobody would have arrived.
Yeah.
But they didn't do that. He arranged a meeting on the proviso that there was a broken lawnmower in the room. And he left the broken lawnmower at the top of the room. And he left the room. And he came back. and there was 20 men standing around the lawnmower trying to fix it, but at the same time, eventually talking about issues that were overlapping in their lives. And grief was one of them, and loss and bereavement by suicide, I've no doubt. And he said at the end of the meeting, the lawnmower was still broken, but these men had opened up in their own way, shoulder to shoulder, as they say, as opposed to approaching it directly with men and kind of going, what's wrong with you? Tell me what's wrong with you. That's not the approach. You have to find a softer way around it. And men are emotional. I'm a man. I'm emotional.
Like myself. Yeah, absolutely.
It's you have to realise that as well.
And it's back to what you were saying about some of the initiatives, and we'll talk about HUGG in a second, but just giving people different outlets to be able to talk about and express their feelings, really, isn't it?
Absolutely. I mean, we hear that saying time and time again, grief is as unique as your fingerprint.
Yeah.
It is, and it isn't. There are universal themes within grief, and there are universal themes within suicide, grief after a suicide. But of course, you've got to take every individual's needs and situations into account and accommodate them as best as possible, ensuring that it's evidence-based and it's supported and it's non-judgmental.
You set up HUGG in 2017. Could you share a little bit of your story about why this came about?
Certainly. The story began when my daughter Millie died by suicide. She died on New Year's Day in 2016 and she was 11 years old.
Right.
So, as you can imagine, her death was traumatic and life-changing. You know, for me, my family, her friends, the community, and there's no roadmap. You expect perhaps the grief police to arrive in and some roadmap to be laid out before you of how to navigate this. But at that time, it absolutely did not exist. So I was simply looking for ways to survive. How could I possibly survive this overwhelming, crushing pain? So it set me on a path of, a bit like going back to our instrumental grievers, I wanted to get up and do. I didn't know I was that type of griever.
Yeah.
So I started researching and asking and questioning because I wanted to understand why. There's never an answer to that, but you have to go through that journey of asking the question. I also wanted to find other humans who had survived this trauma, who were still standing. I needed to see them. I needed to be a witness to their survival to give me hope that I could get there, that I could endure this and that it would change. And that was very difficult. That didn't exist anywhere that I could find. There was individual counselling on offer, but that's not what I was seeking. I set about finding other supports. And that came to be what I now call peer support. I met someone and we looked at what was done across the English-speaking world and adopted best practice and set up a support group in Dublin in 2017, not knowing that that would be the little seed of hope that was planted, that eventually would lead to HUGG being established as a charity and in turn what it is now, a national organisation.
Yeah, amazing. And can I just ask, who are the people that are supported by HUGG?
We support any individual over 18 who has been impacted by suicide. It is not judged by their relationship or the length of time since their bereavement. It is completely open-ended.
Yeah.
It is free of charge and it's accessible. We offer a menu, if you like. We offer a website, which is the signposting piece we spoke about earlier, so people can find that accurate information, whether it is delving into suicide and why it happens and what happens after a suicide, the practicalities, or perhaps somebody who's supporting somebody else and is looking for information. How do you talk about this?
Yeah.
What language do you use? How do you speak to somebody who's been bereaved by suicide? All of these things, because the fear that comes with a suicide bereavement by those around those who have been bereaved cannot be underestimated. And unfortunately, a lot of people are so overwhelmed themselves that they're afraid of saying the wrong thing. So they stand back. So the person bereaved is left with even less support than they should be, because those who should be enabled to support them feel unable to do so and they step away.
Yeah.
So it's very important that we arm people with information and language so that they can be a supportive person in their life. And that is not fixing grief, because we know it cannot be fixed.
Yeah.
There's no magic pill, there's no elixir, but there are very simple things that can happen. And the first thing is listening with compassion, without judgment, and using the right language. For example, we don't say somebody committed suicide.
Yeah.
That language goes back to when suicide was a criminal act in Ireland, was decriminalised in 1993. So it's very important that people learn the correct language. We say somebody died by suicide.
Yeah.
It's no longer a crime. It's no longer considered to be lesser than. So that stigma and that destigmatizing language is a good starting point for everybody. Even that little piece is a huge step forward. So listening with compassion and asking people, what do you need? How can I help? And that could be practical, or for some people who are able, it could be emotional. And it could be simply sitting with the person and listening to them, which is a gift in and of itself.
Yeah.
And then that signposting to services like HUGG and others, where we know that it is evidence-based support with a live voice. So we provide telephone support to people, we listen, and we can help them navigate their loss. Back to what we spoke about, perhaps it's navigating the financial implications, dealing with banks, where do they go? I'll give you a small little sort of example of a lady who came to us. She was in her 70s. Her daughter had died by suicide, her adult daughter, and she had been a single mother. So she left behind 3 teenage children. So you have a grandmother who is now caring and becoming a full-time carer for her 3 grieving teenage grandchildren.
Yeah.
She herself is a grieving mother. So she is trying to navigate the system that she's never been engaged with, as well as dealing with her grief and their grief and all the practicalities around it. And people don't think of that. How could they and how would they?
Yeah.
It's not on their doorstep. But these are the types of situations that people really do need assistance with. We don't provide all the answers, but we provide the roadmap. And then there could be coming to a group or engaging one of our many services for support. So it's all evidence-based. It goes back to like that study. Everything we do is linked into best practice so that we know we're doing no harm and we're helping people not just cope, but re-engage with life.
Yeah. I mean, one thing that you've said a number of times is the listening part for me. Sometimes you hear people say, I don't know what to say, but sometimes it's not about saying something, is it? It's just, as you say, about listening.
Absolutely. There's no magic words that are going to make anything any better.
Yeah.
There are some things that will make it worse.
Yeah.
But you absolutely cannot do any wrong if you just said, I'm very sorry for your loss, and you sat and listened. It's not easy to do.
Yeah.
Sitting with somebody in profound grief is difficult.
Yeah.
It's a big ask, and not everybody's able to do it, and that's okay. So you can do other things, like signposting for them or finding out information for them of where they can get assistance or help or a listening ear. But the gift of listening cannot be underestimated. It's like gold dust.
With regard to listening and active listening, someone said to me recently, the same letters that make up the word listen make up the word silent. It's really difficult in this day and age. Everybody has an opinion on everything. There's a lot of noise in the world.
Yeah.
There's a lot of bad news. It's hard to find time for yourself to sit in silence, let alone added complexity of sitting with someone in such distress. But as Fiona said, if you can sit and listen to somebody, it's really natural reaction to give your opinion or try to superimpose your experience onto them. But that's not helpful in this respect. You need to sit with somebody and sit with them in silence if you need to, and just take on board what they're saying and try and signpost them or offer as much information as you can.
Yeah. You talk about signposting in a timely manner. And also you use the term unique grief, which I think is very poignant the way you describe it. But it is so unique really, isn't it?
It's very unique. There is a shame and a stigma that people carry after a suicide,
Yeah.
where they feel they cannot articulate to someone that their loved one died by suicide for fear of judgment. Because there is judgment out there. There's judgment by people silently or vocally of, oh, I wonder what went on in that family. What happened there? Perhaps there were other issues that might have been known about. People make assumptions. People gossip. People can be unkind. Or sometimes people just assume a certain narrative, which can be very unhelpful. That doesn't happen in any other form of death, perhaps with, a drug overdose or a murder. They're the only other examples that I can think of where that sort of level of shame, stigma and judgment is attached. So when somebody asks how your loved one died, often you'll hear people with an intake of breath, or they won't speak about it for fear of being judged, and their loved one being judged as lesser than, less likely and less deserving of sympathy and of empathy. I had that experience myself at a remembrance service for children in hospital where my daughter had died.
Yeah.
And a man was there and his daughter had died, from cancer, and it was horrendously sad. Of course it was. Everybody there was in profound grief. And he was telling me about his daughter and sharing, a little about him, what she was like with his family. And I was standing there with my sister and he asked me, "Oh, your child died as well?" And I said, "Yes, she did." And, was it cancer? And I said, "No, it was suicide." And he physically took a step back. It was an automatic reaction. It was a shock to him. That's completely understandable.
Yeah.
But that was the end of the conversation. I was asked nothing.
Yeah.
Whether that was a judgment or not, it's a shutting down of somebody's ability to talk about their loved one or to talk about their loss, which carries an extra weight. So you're asking people who've been bereaved to maybe dial down and press down their emotion and their pain because it makes others uncomfortable.
Yeah.
So then people hide how somebody may have died, and then narratives aren't explained and people don't talk about it. And that in itself adds to stigma and adds to people not being able to cope with grief. We know thousands of people who have never spoken about how their loved one died. They say, "Oh, it's private." We say, would it have been so private if it was any other form of death? No, it wouldn't.
Yeah.
It is historical, and there's quite a lot of history that we have to work through to make people comfortable with it. It's not normalising suicide.
Yeah.
It's normalising people's reaction to it. And that's exceptionally important for people to be able to then navigate this narrative and bring it into their lives and live with it. Because we are putting a huge expectation on those bereaved to not only navigate their grief, but navigate your reactions and your possible emotional reaction to that situation.
Yeah. And Ollie, I might just move on to you in terms of your role. You are the National Co-ordinator for Suicide Bereavement. Can you tell me a little bit about your role and the work you do?
Yeah. So in early 2020, the HSE Mental Health, together with the National Office for Suicide Prevention, published a really important report called Improving Suicide Bereavement Supports in Ireland. This report set out 10 core action areas that were identified as essential for the improvement of suicide bereavement supports. Some of these were the development of a suicide bereavement support information pack, a coordinated, consistent approach to delivering suicide bereavement support services, a really important increased focus on children and adolescent supports and support opportunities for national and international research. The last of these 10 core actions was to put in place a National Suicide Bereavement Support Coordinator, which ended up being me, and I took on this role in a part-time basis in 2020 and then on a full-time basis in 2022. So I wasn't long in the role when COVID entered our lives, so it kind of turned things upside down a little bit. But since 2022, I've worked in collaboration with all the key stakeholders in this area, such as Fiona, HUGG, Pieta. I work closely with stakeholders in the suicide bereavement space and also with the likes of the IHF in the bereavement space. I work with Pieta, who provide a range of services nationally to people who experience thoughts of suicide and engage in self-harm, and also those who are bereaved by suicide. And they also work with HSE resource officers for suicide prevention, who work tirelessly across the country on local implementation of Connecting for Life, and also with suicide bereavement liaison officers. There are 12 suicide bereavement liaison officers who work under the umbrella of Pieta and 2 additional suicide bereavement liaison officers who work with the Family Resource Centre in Mayo and Vita House in Roscommon. And these suicide bereavement liaison officers provide assistance and support to families and individuals after the loss of a loved one to suicide.
Okay, and where can people get more information about that?
You'll find out more information about Suicide Bereavement Liaison Service on the NOSP website, nosp.ie, and also on the Pieta website, pieta.ie. And then on the Family Resource Centre website.
So, Ollie, HSE Mental Health Operations and the HSE National Office for Suicide Prevention, NOSP, have lead responsibility for actions related to suicide bereavement supports outlined in Connecting for Life. But how has your work developed over the last few years?
The work has developed significantly over the last few years, Eamon, thanks to ongoing collaboration with individuals and organisations who want to reduce the long-standing stigma of talking about suicide. Not long after I started in 2020, in January 2020, I decided to get business cards done. I had great intentions of travelling around the country, meeting people who've been bereaved by suicide, hearing their story and trying to understand their needs. These business cards are in a drawer under my desk as the COVID pandemic struck soon after. But I'd like to say that through the unprecedented tragedy, people's sense of life and loss deepened. which opened up a conversation in Ireland about how bereavement affects everybody and how important the right supports are at the right time. This is very much the case when it comes to suicide bereavement and working to improve the uniformity, effectiveness and timeliness of support services to families and communities who've been bereaved by suicide. And that's really the heart of my work. People bereaved by suicide have had their world turned upside down, and no matter what way you dress it up, there are no answers when it comes to suicide, which Fiona can attest to. They are high risk in terms of suicide behaviour and deserve their voices to be heard, as working with these people in the postvention space is key to suicide prevention now and going forward.
Okay. When you talk about postvention, can you just explain that term?
So postvention is providing support to those in the aftermath of a tragedy, in this case suicide bereavement. But in the HSE, we would believe that postvention and an increased focus on postvention is prevention. So suicide postvention is prevention. We're trying to equip people who've been bereaved by suicide with information, with materials, with knowledge, with support, so that it can become more familiar to them and that they can support people who potentially have suicidal ideation or are in a difficult place in their lives.
Something that people may not be aware of is that people who have been impacted by suicide initially are at a 10 times higher risk of dying by suicide themselves than the general population. So that is one of the core reasons that timely, relatable, informed support is needed to lower that risk. And as Ollie said, suicide postvention is suicide prevention. It is part of that, and it is everybody's business. So that is the why. It's not just that people deserve the help. It's also to prevent further suicides. People hear about suicide clusters, they hear about contagion, they hear these words spoken about. Sadly, there is a reality to this. So having timely supports helps mitigate against that and also helps prevent further tragedies, because we're not trying to normalise suicide here.
Yeah.
We are trying to normalise the trauma and the grief and make it something that people can accommodate in their life, that it will lessen and it will change, and for people to understand it will not always remain the same. The grief will remain the same. Like the love, it doesn't disappear when somebody dies. But the trauma and those awful, as we call it, tsunamis of pain and overwhelming grief, they will ease. And in fact, there will be greater space in between them. So that grief education, in whatever way people want to take it, formally or informally, written, podcasts, webinars, events, all of these different areas where people can absorb this information in their own time, in the right place, helps them to cope better. In turn, helps with that tsunami of grief we spoke about, those shrapnel wounds. So that information is carried back out through the blast, right through people's lives and communities, which makes this just a greater way of dealing with the grief and trauma, and hopefully prevent further suicides down through the years and through communities.
Yeah, and that's where that timeliness is so important.
Absolutely.
And Ollie, just going back to you, in terms of resources available and supports, do you feel the resources and supports are now being put in place?
Yeah, I think we're getting there, Eamon, but there's so much work to be done in this space. It's beyond belief. It's really only beginning to receive the attention that it needs in the last 4 or 5 years, I would suggest.
Yeah.
We need to understand the needs of people bereaved by suicide. All their needs have to inform the incredible work being done in this area. The lived and living experience is something you hear a lot about in the HSE at the moment. And this is what will bring the devastation of bereavement by suicide to life. HUGG's work in the peer-to-peer space is a testament to this, I think. And just to come back on one of the points that Fiona said earlier on, not everybody will require the same support. Some people need a good friend, a family member. If it's a child or an adolescent, it might be what they call one good adult in their lives.
Yeah.
But more than anything else, some people just need trusted sources of information, online or offline, and you need to meet them where they are on their journey with the right supports. There's no point me contacting the HSE or HUGG or P8 or any of these organisations in complete distress, and on the other side of the fence then these organisations are fumbling around trying to find what you're looking for. It should be ready to go for when they're ready to go.
That's a really good point, yeah.
P8 and HUGG would be the two main services in terms of suicide bereavement, but the HSE NOS would also support the likes of Samaritans, who do incredible work in this area in terms of suicide bereavement, in terms of loneliness, in terms of grief. And we also support First Fortnight, and we work with the National Suicide Research Foundation. And research is one of the key areas that needs to be pushed forward in terms of suicide bereavement. It's practically unknown the impact suicide bereavement has in terms of research. So this is an area in the next 3 or 4 years that we really need to focus on, and finding out what people's experiences are and trying to build plans of work around that.
So building on the research you've done afterwards,
and identifying international research, identifying how that would correlate with what's happening in Ireland. I know Fiona has more understanding of international research in terms of HUGG.
Yeah, I mean, we came back from the IASP, which is the International Association for Suicide Prevention. We had what's called poster presentations, HUGG, on some of the work that we've done.
Yeah.
And it's interesting, the statistic that there's only 1,000 papers per year across the world on suicide bereavement.
Really, yeah.
Per year, which is a drop in the ocean. So there is a lot of known unknowns, and if you cannot understand the depth and the breadth of a problem and how it impacts people, this is lifelong. This is lifelong. People have to realize that when there are not only huge emotional effects when somebody has died, this goes right across to there are job losses, people unable to return to their place of work.
Yeah.
There's more visits to the GP, somatic pain as well as physical pain, hypertension. There is documented fact on, obviously, loss of income. Perhaps the main breadwinner is the person who died. There are caring responsibilities for those left grieving. So again, then you might have more financial burdens which are placed upon people. How do they get out of that situation? Never mind dealing with the grief. So there are lots of practical impacts which are piled upon people when there has been a bereavement by suicide, which are not even thought of. There may have been insurance implications that affect things. So there's quite a lot that has to be done. And some of this can be resolved with good integrated services because it is everybody's business and there just needs to be better understanding. But there are other things that need a deeper dive. The NSRF, the National Suicide Research Foundation, have partnered with us. They've evaluated our work and we've worked with them on the afterwards survey. They're key in Ireland for producing this, and we are keen on continuing to push out the importance to advocate for those who have the least voice in this space because they are so bereft and incapable of advocating for themselves. So that's why we push so hard in HUGG to have the voices of lived experience heard. Because unless you've walked the walk, it's difficult to talk the talk.
Of course.
It's a combination of skills, experience right throughout, and it must all be trauma informed. That's very important.
Yeah. One resource that really stood out to me was the Safe Harbour resource. Just to explain to listeners, it's an illustrated storybook for children bereaved by suicide, which has a mum and dad version. But I just thought it's a lovely, thoughtful resource, and a lot of collaboration went into that. It's a simple story, but you can see the time and effort that went into telling that and the story. But can you talk to me a little bit about that resource?
That is an incredible resource. It came about from one of the National Suicide Research Officers, and we collaborated with her. There was a huge range of people who did it over a number of years to produce this storybook. And it came from the fact that parents are completely paralysed with fear and grief about how do they talk to their child? How do they explain that their dad or their mum has died by suicide? How do you articulate that? And also mind yourself. So a lot of the time, there is no conversations of how the person died. It may come out in the schoolyard. It may come out on the street. It may never come out. So you can just imagine the damage and the layers that can be done because caregivers and guardians just are not equipped to have these exceptionally difficult conversations. So the storybook is a fantastic first step and a starting point for adults and caregivers of young children on how to have that conversation and to do it in a way that's not only gentle and safe, but in a way that it is a storybook. So it can be done at bedtime. So there isn't a fear of this is a traumatic subject that can never be addressed. I mean, Ollie can speak to a little bit more about the resource and where it is.
Yeah.
But for a frontline service like HUGG, it is imperative to have these suites of resources available, and the more of them, the better. This is a fantastic starting point, and it has been a resounding success, sadly, because there are so many children who have been impacted by suicide purely by the statistics of the age of people who've died and the children left behind.
Yeah, and on the wording as well, I mean, you talked about the importance of language earlier. but it just struck me when I was reading it. It's written with that sensitivity in mind, and the language used is so simple, but I just found it so effective.
I can honestly tell you, Eamon, that there wasn't a word in that illustrated storybook that wasn't considered or pored over or looked at a number of times. Whole sentences were looked over. It could take a week to decide on a sentence and what was the most appropriate way to write the sentence, how to frame it. It was a complete labour of love for the project team that were involved in the development of the book.
Yeah.
Since its launch in June 2023, there's been 2,500 copies of the book ordered. There's now 2 books available. There's book A and book B. So book A is where the dad dies by suicide and book B is where the mum dies by suicide. There's also an accompanying guide and other materials that helps parents and carers to read Safe Harbour with their child and empowers them to have really difficult conversations. And as Fiona alluded to, there's an audiobook and a podcast series and activities for children available on this website.
Where is that available?
It's available on the Childhood Bereavement Network website, which is childhoodbereavement.ie/Safe Harbour. And on the day of the launch in June 2023, by the time the launch was over and we got back to our desks that evening, there had already been over 50 requests for the book. So sometimes in this area of work, suicide bereavement, it can all feel a little bit hopeless and you can feel like it's hard to see the impact that you're having. This book had an immediate impact and continues to have an immediate impact.
And are there any other resources you'd like to signpost?
Yeah, I just wanted to signpost to You're Not Alone, which is the National Suicide Bereavement Support Guide. So that would be the level 1 suicide bereavement support offering in this country. And it's available via HSE Resource Officers for Suicide Prevention. It's also available on helppromotion.ie. And also I'd like to draw people's attention to hse.ie/grief. where you'll find information on how to support people who are suffering and need help and assistance in terms of grief.
Okay, thank you. We're coming near the end of the podcast now, but Fiona, actually, I just wanted to ask you what HUGG stands for.
Well, we were trying to think of a nice, an anagram that would stick in people's mind and that wasn't depressing, because you often hear when you talk about grief, it's sadness and it's loss and it's a lot of negative adjectives that are used.
Yeah.
So we really wanted something that would do the opposite. That's not negating the importance of the work, but that perhaps brings a sense of hope with it, and also find a word that isn't currently been used. So initially it was for group, because that's what the organisation was to begin with. So it was Healing Untold Grief Groups. So we had to have Healing Untold Grief Groups because HUGG was for the Help Our Greyhounds. So that was taken. So we ended up with HUGG with the extra G.
Yeah.
But since the organisation has evolved, we don't use the anagram. It just stands for HUGG. So I suppose we think of as HUGG with the extra G because of the importance of the love and the care and the support that we hope we are providing to people.
Yeah, I thought it was a lovely name, actually. And Fiona, just to ask one final question, what would you say to someone listening to us who has been recently bereaved by suicide or knows someone who may want to talk to someone but maybe can't find the words?
First of all, I would say to them to hold on to hope. There is hope. Things will change no matter how desperate it feels at this exact moment in time. Don't give up. There is help and there is hope. And you can check out our website, hugg.ie, as a starting point. You will always find somebody with empathy and compassion to listen to you. That's a good starting point. Or if you have a trusted friend, ask them to reach out for you. And we will look at a menu of supports and help guide you to what might suit you at this stage. There is help out there. There are resources available. They are free of charge. They are open-ended. Just hold on. This will change. You can survive.
Thank you so much. And I must say, if you don't mind me saying, that's a lovely photo, Millie, on your website as well.
Oh, thank you.
And Ollie, just moving to you, it's clear that there's been a lot of work done by the HSE and NOSP and partners in this area, but what would you like to see progress from here?
I'd like to see the new National Suicide Reduction Strategy or policy incorporate far more focus on suicide bereavement and further be continued and meaningful engagement with those who've been bereaved by suicide and for their voices to be heard. At HUGG's recent strategic plan launch, Fiona referred to being bold. I think we all need to be bold. The bereaved by suicide deserve it.
Okay, thank you for that. I'd like to sincerely thank Fiona Tuomey and Ollie Skehan for joining me today. If you have been affected by any of the areas discussed, please visit hse.ie/grief or visit hugg.ie. That's HUGG.ie. To all our listeners, thank you for your continued support and please share this episode. If you would like more information about HSE Health and Wellbeing, follow us on X, take a look at our HSE Health and Wellbeing YouTube channel, or register for our e-zine by emailing healthandwellbeing.communications@hse.ie. This has been the HSE Talking Health and Wellbeing podcast. Thank you for listening.